Hey Nadia.
Hello.
It's not our normal recording time. It's super late at night for
hmm
you,
Yeah,
10:40 p.m.
it's bedtime.
And for me, it's 7:40 at the end of a long day of working. And that's what I wanted to talk about. I wanted to talk about your new job.
Okay. Ask away.
All right. So at Northeastern, where you go to school, all the students, or almost all the students, participate in a co op, which means that for 1, 2, or 3 semesters out of your time during undergraduate, you find, with the help of an advisor,
hmm
a job, usually paid, usually has something to do with your major. Um, or it could be a research position which may not be paid, or you get an international position which will
hmm
likely not be paid. But you chose a paid position in Boston. um, what are you doing?
I'm working at a community health center. I'm basically the medical secretary. I'm the receptionist at the front desk of adult medicine and family medicine, and I'm checking patients in. I'm booking appointments. I'm answering phone calls. It's a lot of multitasking, and I'm not necessarily treating the patients, but I'm still in that like clinical setting, outpatient clinical setting. And I get to be around a lot of medical assistants and nurses and providers as well, which is pretty nice. And in this specific community health center, I get to be around all different types of specialties and just general areas of medicine, which is really cool. And it's all for a specific community of Boston or neighborhood, I guess. Um, but yeah, it's a lot. It's a big change. I'm working, I think it's easier for people to kind of get a sense of what a co op is if I describe it like an internship, because a job, I don't know, I guess temporary job or internship. But although it is temporary, I am working full time. So I'm working 40-hour weeks, and that doesn't like account for like how much I have to, like when I have to wake up so I can take public transportation to get to work and all that. So it's definitely a big change, but I'm really liking it. Um, Today in particular was a little bit hard because I had to wake up a little bit earlier. I started at 8, and then sometimes the clinic can be slow. I don't know. I've worked there for not even 2 weeks, but it feels like I've worked there forever. But the clinic was pretty slow in the morning, and then obviously right as I'm like about to leave, it gets super busy. And because I'm not, accustomed to the way that the clinic works just yet, and the job as a whole, it's a little bit stressful. Um, and they need my help. So it's not like they have extra, I'm not like an extra person. They actually need me there because nobody else like is there to do that job. Um, there's medical assistants everywhere though that can help me out. I think like the medical assistant desks are a lot closer, which is why I'm mentioning that. But like they're closer to the front desk, so I can be like, "Hey, can you help me out with this?" But yeah, it's been really interesting. I've
Do you get to take bathroom breaks? Like, if you're the only person in the front, like, how do you
um
take a break?
for co-ops, like we get lunch break, and they assign those lunch breaks because it's easier to go around the schedule. But I know like I can tell if I look at the schedule like between it's my lunch is going to be between 12 and 1 because that's when the least amount of patients are going to be there, and like people can help out if I'm not there. But as far as bathroom breaks, it's a little bit difficult. Obviously I could take it if I need it, like I have to go, and like I would just have to let someone else know. It's just possible that when I come back, there's just a lot of people that need my help, and a lot of the other co-ops are medical assistants, and the health center also needs medical assistants, so they're not always getting like, they can't always be shadowing someone because everyone has a job that they need to do. So when they're by themselves, I'm by myself, like they can't necessarily step in for me if I'm in the bathroom like other MAs who have been there a while can. Uh, so that's a little bit stressful, but I've been having fun. I just
Do you find work fun?
get no sleep. I I think it's a good change that I needed from school. I don't really like need to do anything when I get home. It just has really altered my schedule, and it's I mean altered my schedule, but I'm revolving work around what I used to do, kind of, just because I feel like if I changed everything, it'd be a little bit difficult mentally. I feel like.
So, what are your
Uh,
initial thoughts? I mean, this is your first big girl job. This is your first time having to work 40-hour weeks.
mm-hmm,
You've had a couple paid positions in the past, but they're more like, you know, projects here and there. Definitely not 40 hours a week.
mm-hmm.
So, as a first time worker, full time worker, what are your thoughts on the life of a worker?
I definitely I have a lot more structure. Well, I have structure in a different way than I did before. A lot of the times my days are like structured by somebody else that has structure, but somebody else is doing it for me. Whereas if I'm taking classes, I'm picking where my classes are and what I'm doing in between. Um, I think that although sometimes it can be unpredictable, it can also it can be predictable and unpredictable. Like I don't know what's gonna be there when I get to work, as far as the patients I'm gonna deal with or the phone calls I'm gonna get, but I know that every day I come into work, these are the expectations for me, which is kind of nice for like, I don't know, ease of mind, I guess.
Have you had
But
any
yeah,
challenging situations yet?
I would say only challenging just because I don't really know what I'm doing yet. It's hard to be answer your first phone call and be like, I don't know what I'm doing, because that's not what a patient really wants to hear. So, yeah, it's a lot of customer service, I feel like, which is also like, I can't think of the word, a code switch, I think.
Mm-hmm.
There's a
Have
different,
you,
like,
speaking of code switch, like, do you feel like the population that you're working with requires you to communicate in a way that's different than your regular way of communication?
well, in the way of, I'm when I'm at school, I'm only surrounded by college students. So yes, but I don't think it's anything out of the ordinary. I think that I have to code switch when it's definitely when it's, a patient that's expressing a problem to me. That's something that I can't necessarily that I don't hear about on a regular basis or can't necessarily relate to. So it's kind of it's a switch I had to turn on to make sure I'm not coming off in a way that they wouldn't want, um, in a way that they wouldn't want to be talked to.
Mm-hmm.
Um,
Have you
I don't
gotten
know.
it?
I'm
Has
still
anybody gotten mad
figuring
at
it
you?
out. No, I mean, I honestly, I just honest like I don't think they're necessarily mad at me. I think it's just them being mad at the situation. I had to tell them like there's honestly nothing I can really do for a lot of things. I can tell nurses, I can send like providers messages, not really, but I can attempt to. through their nurse, and like that's as far as I can go. I can't really do anything else, which is easy for me to say but hard for people to take. um I think also it's recently I've had to contact my own um like doctor's office, and
Oh,
also,
right. You had to do your own, you were on the other side of it and you had to kind of
well,
ask a
I
favor.
I've been on the other side of it before. So even though I didn't like even if I hadn't had to recently, I think I don't know. It's hard for me to call someone and be like that's like I'm talking to a me on the other line, because it's annoying, and it makes me want to like be better at my job, but I can't necessarily do that unless I'm there more, which is just gonna take time. But I don't know. I am the annoyed patient on the other line most of the time, so it's hard to not. I mean, I get to see both sides, but it's hard to accept it.
Well, I think when you're in the receiving end of customer service and you feel like the person on the other line is trying their best to solve your problem and listen to you and doing all that's within their capability, and they're even going out of the way to think outside of the box or logically or just like beyond the canned responses, like they're actually like thinking and trying to help
Right.
you solve the problem to the best of their ability, then
Hmm.
then your people are happy with that.
I mean, I understand that, but right now I honestly can't really do that because I don't really know how everything works. I think it's a thing of like I understand how to do my tasks for the most part, but the health center works in a specific way. So there's, I guess spoken, unspoken rules of like how I approach people, how I'm messaging, all that type of stuff. How, like, if the patient says this, I'm not supposed to contact this, like it's like that type of thing where it's just gonna take time. And so I feel bad when I'm answering the phone now. Um, I feel like I'm giving the best that I can at the moment, but obviously someone else could help them out way more than I could. So, which is hard, but learning
So
process.
you chose this because you're a public health major and you're thinking about working in healthcare, specifically considering um, applying to medical school and becoming a physician. Do you have any thoughts on whether or not you like working in that kind of environment?
I definitely would say that I wish I had more patient interaction, and that not that I'm not getting it with my job, like that's just not what my job entails. So I understand that's not what I'd be getting, but I feel like in the future I'm more considering going to med school because I see like the medical assistants and the providers interacting with patients, and I like the way that works. So I would like to experience that at some point. Um, and it's hard to be on the sidelines and not be able to like do more than the computer allows me to. So that's another thing. Um,
Do you feel like you're
and
able to
yeah,
make a positive difference in the day of the people that you interact with?
I would say when I'm like in when I'm talking face to face, and those interactions mostly are like checking people in or scheduling appointments, which is, I mean, it's pretty. I can't really do more than what they're asking me to. When I'm answering the phone, I can tell if people like have received what I'm saying well, and they'll tell me that patients will tell you like, I really appreciate your help today, or I really I don't know, you just really helped out, and I'm glad I talked to you today, or something like that. Like you could tell over the phone, but in that way, yeah. I feel like I'm making a positive difference. It's just hard that the entire time it's like if I don't agree with what they're saying or like I'm getting annoyed or frustrated, like I'm not gonna be able to express that obviously. So that's difficult.
Do you have to speak any other languages or do you ever have to get translators?
There are interpreters in at the health center for patients. I my Spanish isn't like limited to things that are not medical related, so it doesn't really help. And I feel like getting an interpreter from the health center is probably a better option to get the patients what they need. And I mean, there's also a bunch of other people working behind the desk that can help out, or that just like happen to know Spanish. Um, but yeah, it's hard. I just don't really know medical terms in Spanish, so it's not really helpful for them
Mm-hmm.
or me if I'm the one helping them.
Well, do you think that this experience, it's only been 2 weeks, but do you think, do you have any thoughts about whether or not it's helping you decide whether or not you want to apply to medical school?
Well, I said before that like it makes you want to have more patient interaction, so in that
But
way,
that's not
yes.
doesn't necessarily mean that you're going to medical school. You know what I mean? Like,
Well, sorry. For me, that means I want to go to med school. That's what I'm saying. But I don't know. I'll just have to see. I'm I feel like probably the way I'm approaching it would probably annoy people so much. Like, why can't you just decide or just do it all right now? But
I think it's a big decision.
I'm,
You
yeah,
don't
it's
have to
a big
decide that.
decision, and I'd rather do it on my own terms. I don't know yet. So ask me when this is over, when my co-op's done.
Um, Speaking of other topics, off topic, I wanted to bring up another big thing going on in your life, which we talked about,
Mm-hmm.
which is that you're looking for a place to live. So
Mm-hmm.
these are like the woes of the college student, like figuring out what you want to do with your life in the long run, and then also securing housing. I think it's
Mm-hmm.
pretty tough as a college student. So, any updates on that?
Um, no, I mean, apartment searching is not that fun, and I haven't really been able to help that much because I've been at work. But my roommates are doing most of the work. That isn't touring. I think it's just hard. We live in a city, so it's expensive, and things go by fast, and it's hard to get what you want. So like tackling all of those things at once is a little bit stressful and overwhelming, but I'm glad I get to like I'm glad I have to get to do it with like three other people in my situation. So yeah.
Yeah. I remember that being one of the more stressful parts of being a college student is like not knowing where, like the stress of trying to find an apartment,
Mm,
and then you do it every year, like
yeah.
the end of
Yeah.
every year. But I guess it's like, um, it's a part, a common part of being a young adult. And I guess you can laugh about it later. I had some terrible living situations. One of them,
Mm,
well, okay, it wasn't terrible. It was just, it wasn't terrible because I was living with people that I liked, right? But one of them
mm,
was so dirty, like so gross and dirty. And we were just happy to have our own bedrooms and a
yeah.
kitchen and a balcony. But it was so dirty looking, so outdated. And there was inevitably just a homeless person in our garage whenever we would go in,
Mm,
which was scary. My car got broken into um, one time in that garage.
oh,
And then the next place I lived in was previously a brothel.
yeah.
Like that
That's
wasn't. It was a beautiful home,
Mm,
but we didn't know that it was a brothel before we lived there. And so we were very surprised when we kept getting visitors in the middle of the night ringing our doorbell.
yeah,
Imagine like you living with four of your girlfriends or three of your
right,
girlfriends, and then in the middle of the night, people would just be ringing the doorbell. That's
right.
not okay. Like men would be coming to the door. And like
Mm,
we only found out after we complained to the cops a couple times, and then they're the ones that told us.
right.
Um, I think
Yeah,
maybe we should
that
have
was
known
not.
when we moved in and there were a box of red light bulbs and a box of condoms in the kitchen.
I mean, how would you really know? I think it's hard for us. Just we've been all been pretty lucky with dorm situations the past 2 years of Hartford and Greece, but I think it's hard to find something that I don't know. Not that that is better that we I don't know that can like one up the places that we've been able to stay. Um, but that is also not breaking the bank account. Um, but yeah, it's just been stressful and overwhelming, and I hope we don't live in a brothel. But I guess if that's the only apartment left, we're gonna probably gonna have to.
I wouldn't
Um,
say it'd be a good idea to knowingly go into this situation, but it was still a nice place. It was a beautiful home. Um, I don't think we would have said yes to it if had we known what the history was, but
right.
it turned out
Who's
to be
gonna tell you
fine.
that?
Your dad lived in a apartment without a bed for like
Yeah,
4 months. He didn't have a bed. That was before he started dating me.
I
And
couldn't
I
do
was like,
that.
why don't you have a bed? And why are you sleeping on this nasty couch
Yeah, that's not for
um,
me.
that came from someone's garage? He also spent, I think, a semester sleeping on a beanbag.
See, he's just different. I can't even compare to that because I'm not putting myself on a beanbag for a month. I mean, more than a month. That's terrible.
Anything else going on in your life?
Mm, no, it's just work and apartment stuff. But other than that, my life has been pretty much the same as last semester.
No
But
homework,
we'll see what
though.
happens. Yeah, but I'm tired at 8:30 now, so that's doesn't really help with anything. And also most of my friends are non-co-op, so they have homework. I just get to sit and watch them. Maybe do a puzzle.
All right. Well, thank your roommate for letting you use the room while we did the podcast at 11 p.m. Boston time.
Yeah, I will.
All right. See you next week.
Bye guys.
Bye.